Looking to elevate your complex prep? Dive into RemedyOMM.com. Discover our comprehensive question bank, expert lectures, and personalized consultation services, all tailored for your success. Join the community of achievers. Visit RemedyOMM.com today and take the next step in your medical journey.
Hello everybody, welcome back to Remedy OMM. I highly recommend you check out part 1 of this rib series where we go over basic anatomy and function before watching this video. In this lecture, we will be going over diagnosis and treatment of ribs. There are two main rib dysfunctions you need to know: inhalation dysfunctions and exhalation dysfunctions. These classifications describe restrictions in the movement pattern of a rib or group of ribs. Remember, a somatic dysfunction is named for the direction of ease, so knowing the normal rib movement patterns, we can diagnose rib dysfunctions by palpating them and observing where a restriction may be and which ribs are involved. Inhalation dysfunctions describe a rib that is restricted in exhalation. It will seem like it is stuck in an inhalation position. Exhalation dysfunctions describe a rib that is restricted in inhalation. It will seem like it is stuck in the exhalation position. This is the most important thing to know when it comes to rib dysfunctions: identifying the key rib. When a dysfunction of the ribs is present, the vast majority of the time it will be a group dysfunction, meaning multiple ribs will exhibit dysfunction. Once you've determined if the dysfunction is inhalation or exhalation, you can then determine the key rib, as the key rib needs to be treated first and will sometimes correct all other rib dysfunctions. You need to know the mnemonic BITE, B-I-T-E. This stands for bottom inhalation, top exhalation, which means that the bottom rib is the key rib in an inhalation dysfunction and the top rib is the key rib in an exhalation dysfunction. So in an inhalation dysfunction, the bottom rib needs to be treated first and vice versa. Let's look at a very basic example. Let's say a patient presents to clinic with right-sided shoulder pain, and after thorough examination, you have determined that the ribs 2 through 4 on the right are restricted in exhalation. Which rib will you treat first? In this example, we first need to identify the dysfunction. Given that the patient's ribs are restricted in exhalation, this means we have an inhalation dysfunction. Recall that we name a somatic dysfunction for the direction of ease. Now that we know what kind of dysfunction we have, we can identify the key rib. Remember our mnemonic, BITE. Since this is an inhalation dysfunction, the bottom rib will be the key rib, which in this example is rib 4. This means that our treatment will be directed towards rib 4. With a little practice, this will come easily, and now that we are able to determine which rib is the key rib, we can talk about treatment. There are 3 ways to help treat rib dysfunctions. These include muscle energy, HVLA, and facilitated positional release, or FPR. It is difficult to write test questions for HVLA and FPR treatments regarding ribs, therefore I've determined that these are lower yield. If they do give you a question regarding HVLA or FPR, it will be regarding positioning of you as the provider in relation to the patient. Muscle energy, on the other hand, is super high yield compared to the other 2 and isn't too difficult. When it comes to muscle energy, this is where knowing which muscles insert on which ribs is crucial. This is very high yield. You should know that there is a bit of overlap of these muscles. However, test makers focus on the unique rib insertions for each muscle, so I have simplified the insertions for ease of understanding and memorization. First, you have the scalenes. The anterior and middle elevate rib 1, while the posterior elevates rib 2. The pectoralis minor attaches to ribs 3 through 5. This is innervated by the medial pectoral nerve. The serratus anterior attaches to ribs 6 through 8. Innervated by the long thoracic nerve. Damage to the long thoracic nerve can lead to scapular winging medially. The latissimus dorsi attaches to the ribs on ribs 9 through 11, and the quadratus lumborum attaches to rib 12. It may seem like a lot, but with repetition it will become easy. Again, a very high yield topic that I highly recommend you memorize. That's all I have for rib treatment. Remember the BITE mnemonic to determine the key rib and which muscles attach onto which ribs, and you'll be fine. Please like, subscribe, and support our channel. If you have any questions, please don't hesitate to comment below. We will see you guys in the next lecture.